Namaste. IGV and Dr. Shama Ghazi from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about galaezzi fracture. This is the kind of the fracture which comes under the program orthopedic. Program name is BPT 5th semester and DPT 5th semester, orthopedics and sports injuries, and includes the course name as orthopedics. The session name we are going to discuss about here is galaezzi fracture. So let's start with galaezzi fracture. Galaezzi fracture is a fracture of the distal 1/3 radius shaft and associated with the distal radio-ulnar joint. This is known as distal radio-ulnar joint injury. Incidence of distal radio-ulnar joint instabilities occur if the radial fracture is more than 7.5 centimeter from articular surface, unstable in 55%. If fracture is more than 7.5 centimeter from articular surface, unstable in 6%. Mechanism is the distal wrist trauma, typical dorsolateral aspect, fall onto outstretched hand with forearm in pronation, outstretched hand with the forearm in pronation. The anatomy which the joint is included as the distal radio-ulnar joint, sigmoid notch, found along ulnar border of distal radius. It is shallow concavity for the articulating ulnar head, volar and dorsal radio-ulnar ligaments, function as the primary stabilizer of the distal radio-ulnar joint, most stable in supination. The classification involves all the anatomical classification of radius and ulna include under subgroup and qualifications as radius ulna dysphagial simple fracture of radius with dislocation of distal radial ulnar joint, radius ulna dysphagial simple fracture of both bones, distal zones radius with dislocation, radius ulna diaphyseal wedge fracture of radius with dislocation of distal radius, radial ulnar joint, radius ulna diaphyseal wedge of both bones with dislocation of distal radio-ulnar joint, radius ulna diaphyseal simple fracture of radius with dislocation of distal radio-ulnar joint, radius ulna diaphyseal simple fracture of both bones, distal zone radius with disarticulation. As the presentation or the after doing the assessment, we can found as thing of symptom, the pain, swelling, deformity. If we are going to do physical examination, there is point tenderness over fracture site. The range of motion is decreased. Test forearm supination and pronation for stability. Distal radio-ulnar joint stress causes wrist or midline forearm pain. There is a diagnosis where we are going to diagnose as radiographs. Recommended views are AP and lateral views of forearm, elbow, and wrist. Finding sign of digital radio-ulnar joint injury, ulnar styloid bending of the joint of anterior posterior view, dorsal or volar displacement on lateral view, radial shortening. Treatment. If we are going For operative or surgical treatment, there are ORIF, which is open reduction, internal fixation of radius with reduction and stabilization of distal radio-ulnar joint. Indication, all cases as anatomical reduction of distal radial ulnar joint is required. Acute operative treatment for superior to late reconstruction. Surgical trucking technique, ORIF of radius, approach volar, approach of radius, plate fixation, perform anatomical plate fixation of radial shaft. Radial bow must be restored, maintained. Reduction and stabilization of distal radio ulnar joint. Approach, dorsal capsulotomy, reduction technique, immobilization and supination for 6 weeks. Indication if distal radio ulnar joint stable following ORIF of radius, percutaneous pin fixation. Indicated if distal radio ulnar joint deducible by unstable following ORIF of radius, cross pin ulnar to radius, leaves pin in place for 4 to 6 weeks. Open surgical reduction indicated if reduction is blocked. Suspect interposition of external carpi unlaris tendon. Open reduction internal fixation indicates if a range large ulnar styloid fragment exists, a fixed styloid and immobilized in supination. Complication, compartment syndrome, increased risk with high energy crush injury, open fracture, vascular injury, or coagulopathies. Diagnosis, pain with passive stats in more sensitive neurovascular injury. Uncommon aspect, type 3 open fracture, refracture usually occurs following plate removal. Increased risk with removing plate too early, large plate, comminuted fracture, persistent radiographic recency, prevention, do not remove plate before 18 months after insertion, amount to time needed for complete primary bone healing, non-union, malunion, distal radio joint subluxation, displaced by gravity, pronator quadratus, and brachioradialis. So this was all about the galaezzi fracture. So if you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jayoti Vidyapeeth Women's University. Namaste. Khush rahiye.